Good morning, everybody. So this is a video on successful management of, will you please play? Successful management of an incomplete femto laser cap cut during the silk surgery. So as we see that when we started the surgery, the patient is well centered and applanation could be well achieved. Even the laser was fired well, but at this point of time, it's not a real-time image and we could not see that the patient had slightly shifted. And when we took him on the microscope, we could not find the entry cut at all. But as we see, the other parts of the laser are well centered, the OBL is well formed, and therefore we tried to give a manual entry cut with the help of a side port knife. So a manual entry cut was made with a 15-degree side port, and since there will be only one plane, there was no point of getting any wrong entry or anything. And we could easily find the anterior as well as the posterior planes with the help of the dissector. After understanding that both the planes are nicely formed, then we entered the entry, the anterior and the posterior areas, and the lenticule could be dissected out very smoothly. And had a very good post-operative visual outcome as well. So in case we have a disturbed femto entry, even then the lenticule procedure can be carried out.
Yeah, so in fact it's a very common
Yes.
thing which happens during smile as well, and we have to be, after
Very
certain
careful.
practice, yes, we get the hang of it, that where we have to put, and if make sure that both the lenticles are properly dissected
made.
before you go in and do these
Ma'am, but
maneuvers,
here
yeah.
one more challenge was that with silk, we don't have the visual while the laser is being fired. So we don't exactly know at what point the patient had moved. So we have to assess according to the OBL formation. I had one more patient, same patient, in that the patient had moved slightly 2 seconds before the entry cut. So even the anterior plane formation was decentered. So there we did not try this.
Yeah, so it's
there
a very,
we turn how
very
we converted
strategic
to
balance.
flap.
We have to see whether we have to continue the surgery or best is to just abandon
And
it or
convert
convert
it
it
to
into
flap.
flap. Yeah.